down is look up. Assemble the team.
It's showtime.
The brains waking up.
What'd you have for breakfast?
We are the sound of Lagos, and this is Mainland 98.3 FM.
You didn't see that coming, did you?
Yeah, I know what this is.
98.3 Mainland FM.
Good morning and welcome to Mainland 98.3 FM, the sound of Lagos. My name is Sage Babalola. As you know, every Friday from 10:15 a.m. to 11 a.m. we have conversations about health and safety. Now, this is not a specialized program like Mother and Child where we focus primarily on women and children. We decided to also, show you that we care about the general populace and the things you need to do to be safe, to be healthy, whether it be diet, whether it be physical exercise or whatnot. Sage is my name once again. Today is not going to be different from any of the other conversations that we have on Health Plus on Mainland 98.3 FM, but it is something of a, should I call it a special edition, and I'll give you my reasons. This is because the conversation we're going to have today is something that affects not just Nigeria. It's not specific to Nigeria. It's a global epidemic of some kind, and medical experts around the world are starting to worry about the future of the country, of the world, if this epidemic of some sort is not handled very quickly. Today on Health Plus, we're going to have a conversation around implication of smoking. Yes, we're talking about smoking, and I know many of you that are listening right now would understand why I had that introduction earlier about it being a global epidemic. I know you were expecting a disease of some sort like COVID or what have you. Well, smoking is an epidemic, and many health experts have described it as such. Today, I'm not going to be alone. As always, we like to always engage the services of healthcare practitioners, people who have been in the business, who have seen these things and can give us first account of why the situations should not be, and also the implication it would have in the long term. Well, today, like I said, we're talking about implication of smoking. And before I get to introducing to you the guests that we have in the studio today, we're going to have two people join us though. Unfortunately, my second guest is running late, but she would be here hopefully before the end of the conversation. So before I go to introducing the guests that we have, I would like to give us some sort of figures. I like to give us statistics. If you are a follower of Help Plus, you know that we like to lay the foundation giving you statistics so that you can reconcile why these conversations are important. Now, there are around 1.1 billion smokers worldwide, and about 80% of these live in low and middle income countries like Nigeria. Now, Nigeria is the most populous country in Africa and has one of the leading tobacco markets in Africa, with over 18 billion cigarettes sold annually. Now, according to a report by Marco Castrodori, now he's a research associate at the Center for the Study of Economies of Africa, over 30,000 smoking-related deaths are recorded in Nigeria annually, and this has triggered a corresponding annual treatment cost of over 500 billion naira, which is equivalent to over 0.36 of our total GDP, and this is as far back as 2019. Now, aside from the alarming health implication of smoking and general tobacco usage, the World Health Organization's team for the World No Tobacco Day of this year, which was May 31st, 2023, the team was grow food, not tobacco. And this further highlights the long-term economic consequences, including food insecurity, that the thriving tobacco market and smoking can have on the entire nation. Now, joining me this morning on Help Plus to discuss the medical, the social, the economic, even the psychological consequences of smoking is Dr. Biyi Durojaye. When my second guest comes in, I would introduce her. But for now, we do have Dr. Biyi in the studio, and we will proceed the conversation with him. Dr. Biyi, it's such a pleasure to have you. Thank you for joining us.
Yeah, thank you very much. Thank you very much.
Of course.
For having me today.
Yes. So I did the best I can in my layman's ability to put forward figures, and I also highlighted the fact that yes, this is a medical concern, but unfortunately these things are interrelated. A medical concern that becomes a social concern, that becomes an economic concern, to the point of even affecting agriculture, which should be the mainstay of every country's economy. But let's focus more on the medical aspect, since that's your forte. So the increasing prevalence of smoking, especially in Nigeria, has become a problem, and you would know because whilst I was dishing out the statistics, you were nodding in acceptance like yes, it is a problem. And it's even more worrisome because we have 4.7 million adults of that statistics that smoke. We can get it that these are adults, they can make decision, but unfortunately 25,000 children and adolescents between the ages of 10 to 14 contribute to that statistics. 10 to 14 years old make up 25,000 of the figures that we have right now. Let's open this conversation by you talking to us about the smoking culture in Nigeria, first of all, before we proceed.
All right. Okay, so thank you for having me today.
Sure.
Yeah. So basically, smoking is a leading cause of preventable disease and morbidity, right? Okay. And well, in Nigeria, there's no current epidemiological data.
Yeah,
that's
horrible with data.
Yes. So, but like you said, it's very serious amongst young, most especially secondary school students within the ages 14, 15, 16 years, and is so alarming, right? Because in Nigeria here, and sometimes you can even trace it down to the fact that some of these children are being abandoned, right? Some of them on the streets, they necessarily don't have people to cater for them, right? And they end up getting into behaviors like this, and then they start smoking, and that affects them psychologically, that affects them even in education too, right? So, and the thing about smoking here is that when it starts at a very young age, you get addicted to it. And that's why you see, if you check those that are adults that smoking right now, and you trace back to when they started,
right,
they started at that age, 14, 15, 16.
Right.
So it's a very, very serious thing in this community. In fact, you would in Lagos, for example, if you look at if you go around and ask, right, and you take like 10 men, you see that 8 out of 10 smokes.
Right.
That's alarming. Yes.
Thank you very much, Dr. Biyi Durojaye. Whilst we were conversing, we did have our second guest walking. We've been waiting. She is a representative of Brahma Kumaris. I'm going to be very, very conscious of how I pronounce certain things because I don't want to make a mistake. I usually don't like to say names wrong. But her name is Sister Olamide Gauthami. Please tell me I said that right.
Good morning. Very well said.
Yes, okay. I think I'm doing better with names now.
Absolutely.
Thank
fine.
you so much for joining us. So we started the conversation already. I gave out the statistics, and the question I asked was the smoking culture in Nigeria. So I mean, you've should I say connected with a lot of people, Nigerians, and now I'm not trying to say that this is a Nigeria specific problem, but
True.
of course you have related with a lot of
Yes.
Nigerians who unfortunately smoke. So I would
Right.
also like for you to say something about the smoking culture, what you think is making the numbers to skyrocket so much. Why are more people smoking? Why are children between the ages of 10 to 14 smoking to the point where they become full-grown adults?
See, it's no more the problem of Nigeria. It is the epidemic which has really affected the whole world, whether it is Nigeria, whether it is India, America, whichever place it is. The tensions that human beings are facing nowadays, and especially there are an amount of ignorance, the lack of awareness, all of these things have really probed this problem to increase. WHO has been really making it more significant, and these type of days like World No Tobacco Day, which is being celebrated or commemorated on May 31st, is the very purpose of it is only to create an awareness. And this particular thing is more in young adults, as you say, even among the children in school, because it has been introduced to all of those people who are ignorant about all of these things. Age is not a barrier, but the most of the cases are seen in young adults.
Thank you.
This is because weak mind, lack of awareness, and there are many such practices. That is the tension little bit that we have, because at every level, in the family level, in relationships level, everyone is giving a target to each other. If you reach this target, then I am happy, you are happy, and we are happy.
So the pressure,
stress will reduce the power of mind and the quality of thoughts, and this this tobacco is not a small thing. There are two types of smoking. It's not just.
We'll
we will get into that.
Yes, I
later.
just wanted us to, have a strong introduction before we proceed. So, the tobacco epidemic, like I said before, is one of the biggest health concerns as it stands right now. I know that we have other diseases that don't have any cure and what have you, but for doctors to say that this is a very, very huge issue, 1.2 million deaths, that is from even secondhand exposure. 8 million people die for smoking directly or tobacco usage. But for you being around people who smoke, being an environment where people smoke, there's a possibility that 1.2 million of people who just stay around smokers can actually die. So let's talk about these figures, about the death rates. Let's talk about tobacco in itself, because I'm glad that Mr. Olamide already brought that up. Let's talk about tobacco as a substance in itself, and then let's also talk about all the many health implications that have been associated with the usage of this particular substance.
All right.
Dr. B, please, you first.
All right. So, tobacco is a substance in itself. Comprises of two things, right? We have the solid particle and we have the gaseous particle, right? So the solid particle comprises of the nicotine, tar, while the gaseous particle comprises of the carbon monoxides, the formaldehydes, those poisonous gases, right? That can and in fact those gases comprise of 80% of or 90% thereabout of the total content of tobacco itself, right? So it's just imagine you smoking that and then having those poisonous gases in you, right? So for example, our blood is made up of hemoglobins, right? That
Convey
helps
oxygen and
to
what have
oxygen
you,
and all those
yeah.
things. Yeah. So if when you're now smoking those gaseous substances and then they mix with, so they end up binding with hemoglobin, right? And there's no enough room for the oxygen, so they now
Right.
start causing some problems in the body, right? And something about smoking is that it affects every part of the body. It's not just about the lungs.
True.
It's not about the
heart or what have you.
everywhere in the body, even the skin. Yes, everywhere in the body. And if you hear about cancers, right? And yes, very importantly, the smoke, the
Tar.
right,
Right.
because people always have this genetic susceptibility to cancer. Is a very smoking is a very dangerous thing, and it's just very important that
Really
yes.
lead to this conditions,
Yes.
cancer, like you said, the skin, even the dentition, because I did have a conversation with the dentist one time, and that the integrity of your teeth can actually be affected if you are a chronic smoker. So is there anything like a safe exposure to tobacco, or it doesn't matter whether in small or large quantity, as long as you consume the product, would you be affected?
Okay, so the thing about the product is, like I said, it has nicotine, right? So that nicotine, if you start smoking it, so what it does is that it goes to your brain, right? When you take a puff, it goes to your brain. It stimulates the brain, and then the brain produces a neurotransmitter. And that example of a neurotransmitter, which is common, is dopamine.
Yeah.
Yes. So that dopamine just makes you feel good, right? So imagine someone already taking that, and then it's feeling good. He wants to take more. So starting is not even, it's not good, right? So the moment it starts, you can get addicted to it. So I don't think there's any safe, it's just better not to start at all.
True.
Right?
Right.
Yeah.
I mean, Sister Gauthami, you must have, been around people who have maybe, I don't know, family members who have lost someone to smoking, or who have had to, watch their family member be, I don't know, admitted into therapy, although we'll get into that for a fact. What exactly is that experience like? What exactly is that interaction like? Just being around people who are chronic smokers, the feeling of, helplessness, first of all, that you're not even able to help them through that difficult process, especially if you're one of the factors that contribute to the initial pressure that made them even, start using that particular substance. Speak us, talk to us about that particular interaction. People who are even related to people who use tobacco.
I would like to give a more clarity about it, because as doctor said, that is, smoking is injurious, dangerous, damaging to whatever extent or intensity is. So here we have three types of smoking people. One is smoking directly, the second hand smoking,
Yes.
and the third hand smoking as well exists. And smoking also is done in two ways. Number one is smoking, and then number one is smokeless cigarettes, or also tobacco also is available. Smoking tobacco and smokeless tobacco. That is, smokeless tobacco are e-cigarettes
Right.
that those are
The
used.
plastic
They
is
say
even horrible.
e-cigarettes are very good, harmless, and they don't create so much of damage. But these e-cigarettes are like e-hookah, BD, there are plenty like
Yeah.
e-pen, K-pen, something.
Yeah, like-
I made a list of it because I don't
Oh, no,
use
definitely.
it. I only use it. I only learn when people come for counseling for
Right.
such things. So these are the big lists that they speak about. But then any amount of nicotine is just hazardous to the physical, mental, social health of the whole society and also to the world at large. So the second hand smoking is those who are inhaling, the smokers, staying with them close
Yes.
and being in the family under one roof or spending time with them. And the third hand smoking is those when you smoke, the smoke just spreads and it just doesn't disappear, but it enters into your clothes, enter into your body, enter into a bed, on your walls, on your doors and windows. It's there. So when those chemicals are there, they will certainly show their effect, isn't it?
So you're saying
every
that I'm
cigarette-
sorry. Yeah. So you're saying that it's not just the emotional impact that it has in people who stay with them.
Right.
As being around them as a secondhand smoker, it means that you are just as there's a possibility that you're just as affected as the person who's
person,
actually
yes.
smoking, whether
Yes.
smokeless or e-cigarettes or what
Whichever
have you.
yes.
It doesn't matter. Anyways,
52% are such people who are getting cancer just being second and third.
Just being
hand,
close to people who
close to
smoke.
people who are, yes.
quite unfortunate.
I just want to say one thing
Yes,
here.
please go ahead.
Every cigarette can really emit 7,000 different type of chemicals, and all of them mostly are hazardous. 250 of them is extremely damaging, extremely damaging. And people are trying to overcome to get liberated from this addiction. But then 70%, 100% have that thought. 100% have the knowledge that this is injurious, but only 70% are try. But only 5% are able to overcome it.
If you're just joining us, this is Health Plus on Mainland 98.3 FM. We're talking about the implications of smoking. I do have Dr. Biyi Durojaye here with me in the studio, and also, like I said, a representative of Brahma Kumaris, who is Sister Olamide Gauthami. I would like to describe her as something of a wellness coach, if I might.
Thank
and
you.
Dr. Durojaye is here to give us all the medical terminologies and, all the chemical compositions and what have you. Sister Olamide will talk to us about, how it affects the environment, how to get through the process, counseling, how to even use diet and what have you. Everything is interconnected, like I said before. That's why we have two people, who are skilled about this, but then the approach is somewhat different, but very effective. All right, so let's talk about how smoking affects the sexes, and I'm talking about men and women. Smoking affects everybody, it's irrespective of gender, but doctors, medical practitioners would tell us that the implications are somewhat different in men and women. Though we have more men who are probably going to be smokers, we have more men that would probably smoke, because societal construct puts a lot of pressure on men, and like Sister Olamide has highlighted, pressure is one of the leading causes of why people smoke. But in that same vein, women somewhat have some sort of female vulnerability. They're most likely going to suffer from more smoke related morbidities than men, even if they don't smoke as much as men. So I would first like you to go, Dr. B, to talk to us about maybe juxtapose, contrast, give us the comparison. How does smoking affect men? How does smoking affect women? And in there, if you can, lay a little bit of emphasis on smoking and pregnancy, because that's a concern as well. Please go ahead.
Yes.
All right. Okay, thank you very much. Okay, so the thing is, smoking actually affects both gender. And the only difference between both gender basically is just the reproductive aspect of it.
Yes.
Right. Okay, so for the reproductive aspect of it, that's a female. Right. So basically it causes is an inducer for cancers like breast cancers, cervical cancers. Right. Okay, and also for the reproductive aspects, it also affects for a woman that wants to give birth, that wants to conceive. It's always a problem if she's a smoker. It's always a problem for her to conceive, right? And even if she even conceives at the end of the day, there's something we call ectopic pregnancy. It's possible she can be predisposed
Pregnancy
to
outside the uterus.
Exactly, right? So even when she's even pregnant, even when the child is inside the uterus, there's also something we call the abruptio placentae, right? Just what it means is that when there's a detachment of the placenta, just after the age of viability. Basically, it's just an early detachment of the placenta, not at the time of labor, when it's earlier before labor, and at the end of the day, can lead to prematurity. The child can come out at the time
It's not supposed to.
Exactly. So things like these are things, and for the child inside too, right? It can also cause some form of deformities. Right. Yeah, form of deformities like cleft lips and palate. That's when there's a deformity in the lips and the palate, right? And it can also cause some art defects for the child, right? And also, it can also cause an intrauterine death, right? When the child will die inside the uterus. Yes. So these are things that can affect women that are pregnant, that are predisposed to smoking. Most especially, even might not even necessarily them smoking, may also even be their husband. Yes, second-hand smokers. So and that's why when they come in like that, we always want to know, once they can history, to know if they are smoking or people around them, or they stay somewhere that people smoke around, because it has its own effects on the child. Also has its own effects on the mother herself, right? And also some other health effects of smoking, both to men and to women, most especially the men. Right, there's something we call the COPD, the chronic obstructive pulmonary disease. Right, so it's just a problem of the lungs, where the lungs it gets inflated, but when you breathe in, you cannot necessarily breathe out. So you have a problem breathing out as a result of smoking too. Right, so also lung cancers, like I mentioned previously. So there are many diseases, even stroke. Yes, it can also affect, when it affects blood vessels, and then there's not enough blood going to the brain, and then brain dies, and then that's the stroke. So there are many things that can really, the impacts that smoking can cause on both men and women. In fact, it can even lead to comorbidities like hypertension and diabetes. That's why if you see, especially when they come in like that, we want to know if they smoke.
You have a history of smoking.
Yes. So
it's so unfortunate that with this amount of information out there, because I know people know, that we still have this high prevalence of smoking. So now think of a woman in the family who doesn't smoke, is healthy in a manner of speaking, goes for an antenatal, but then she has a husband who smokes. So just because you have a husband who smokes, you can have problems in your pregnancy. You can have a deformed baby. You can have your baby come out preterm, doesn't complete the 40 weeks duration. You could have a lot of complications just because you're in the house. So it's not just you, it's even the baby who knows absolutely nothing about the behavior of the father to be. I would like to hear from him, because I know that there's a possibility that more women would want to speak to you, because I know that in Nigeria, men are not very open to wellness coaching. Well, some are, but the percentage, women usually are more comfortable talking about their problems. So talk to us about smoking, the effect that it has on women, the effect it has on men when they come to you for counseling. What usually is their problem? Is it usually social? Is it usually emotional? Is it usually health related? What exactly is it like when women come to talk to you about smoke related problems, and when men come to talk to you about smoke related problems?
As I see, and you want me to differentiate properly about men and women. And men is all about the tension and pressure that they take. And right from the age, as young as you can quote, there's a stress, there's a pressure to achieve something, to reach to a certain extent of success, and to attain something. These are all the desires. But these desires, it's all create the weak, make the mind weak. And that's the reason they are getting into support system to make them emotionally feel good factor is missing in their life.
Right.
And so the pressure of the relationships and the pressure of the society as well, and everything is really giving probe to these type of things. And women especially, yes, they have to balance a lot. Today's woman is not that woman as olden days. She has to keep up with her family and work, and also sometimes some women are studying and working together and taking care of the family responsibility. I see Nigerian women are extraordinary people, not than any other woman. They really are, I tell you. And they are born with they are gifted with also with good physique, but at the same time, these type of emotional imbalances especially, and mental stress, these are the major reasons, what I have noticed, are the reason for both men and women to take this support system of smoke. The very first thought when they take that first cigarette,
and the dopamine comes in and they feel great.
They feel great. they feel it's reality.
Right.
When even they get educated about it, this deception subtly is going on inside, and they deceive themselves that this is permanent happiness. This is a solution for all the stress.
And then it fades, they need it again.
Yes.
Right. I would like to talk to, I don't know if you're familiar with the concept of the shisha smoking. I mean, you must have heard about it. So here's the thing. I also like to do a lot of myth debunking, right? Because I have heard people, I would like to say I'm a young person, and I've been around young people, and they'll say, I don't smoke, but I take shisha. I don't know, maybe it's because I'm enlightened about these things is why I am extremely thrown back. What do you mean? Okay, so what do you do with the shisha? Do you breathe it?
May I just ask you, what is shisha?
Okay.
Is it a drug?
No, it's the one that the hookah.
Hookah.
Yeah,
Okay.
but I said shisha because that's the term, and that's the lingo. That's how it's said.
Great.
But hookah, it is hookah, right? So and then you see people, and I think hookah smoking, for the sake of conversation and inclusion, is very common amongst women because they feel like I don't smoke, I don't do cigarettes, I don't so shisha smoke is just for leisure, right? It's not as deleterious as actual tobacco or cigarette or what have you. I would like for you to tell us, is that mentality, is that notion actually the truth? Is shisha less dangerous or hookah less dangerous than cigarettes like they think, or is it even worse? And also, is the effect almost the same as other tobacco products, or is it even worse off?
Right. Okay, so shisha, or is it hookah?
Hookah, yeah. Right.
So it contains polycyclic hydrocarbons, volatile aldehydes, and carbon monoxides. Just something similar to the tobacco. Yeah. But the problem is, and the reason for the misconception is that when they sell those things, they tell them, oh, it's just flavor.
And it's flavored, mango
flavor,
and what have you.
Nothing else.
Smells nice. It smells nice.
They even say to the extent that, okay, the way it's set up. It has a water, it's bubbling. Oh, it's nothing like that. It's not like the cigarette you're smoking. In fact, people that even smoking shisha would even insult those that are smoking cigarette that you smoke. That's nonsense.
I don't.
You don't smoke, right? So okay, so for the cigarettes, at the back of the cigarettes, there's this health
advisory
yes, advisory at the back of the cigarettes that tells them that, oh, if you smoke so amount of cigarettes is bad for your health and those things. But for the shisha, is not
nothing like that.
In fact, when you go to clubs and parties, they'll just give it to you and they'll tell you this is good for the health. It's just flavor, and so I think that's one big problem, right? The awareness about shisha being dangerous and the components of shisha is the problem of that particular. And again, for the fact, I just mentioned some of those substances that inside shisha, they're also very harmful. In fact, people will even say that they're even more harmful than cigarettes, right? Just because there's this. Okay, for the fact that we already know the health implication of cigarettes, people tend to smoke just a little, stop. But for the shisha, they just smoke it and they don't even care how.
No control, nothing, because they think it's healthier.
Safe and it's healthier. Exactly. So that I think that's the problem. That's what we need to work on. But it's very, very dangerous. I even think it's more dangerous than the cigarette smoking. Yes.
Do you agree, Sister Gauthami, that hookah, right? It's done a lot. I mean, you see it at parties. In fact, to a large extent, it's something cultural, because there are many cultures, even here in Africa, where they feel like it's a necessary thing of leisure at parties. And just like the doctor said, they believe it's just, for fun. It's not as dangerous as smoking. You're not putting tobacco in your mouth or nothing like that. Have you also had experiences like that? And what do you say about the misconception?
Even in India.
Right, okay.
It is a very common culture.
All right.
India is the history of India is full of country kings and nawabs and all this richly people. And even today, when we see in the movies, in the stories, they mention that there is a person who is very royal rich. It's a symbol of royalty, richness, status, and all of that. And women also well dressed with lot of gold studded things, and they can do hookah. And it has been symbolized as a culture of royalty, but then status symbol. But then it has the similar effect, as the doctor said. It is no less, and it comes under the smokeless tobacco. Smokeless tobacco is in the form of hookah, and chewing tobacco. And in India, they eat pan. Pan is a digestive leaf which they eat after the food, and it's also a matter of royalty. They eat it. They can eat anything, all fried oil stuff, and eat pan. Pan is a betel leaf. So in the betel leaf, normally they put rose petals, coconut shredding, and dates for sweetness, and such type of spices in it. But then these people who are hookah addicts, they put chewing tobacco things, and they fold it and they eat. This is a pan flavor, and they enjoy that tobacco. They are not really recognizing that this thing is spoiling their teeth, throat, neck, shoulder. As he said, whole body organs are affected. Not just cancerous, but there are chronic diseases which are, they are raised associated with if you have little, it'll be increasing, the intensity will be more. If you don't have, even any organ is weak, then this tobacco effect in any form you consume, you smoke or you chew or you do whatever, but then that organ becomes functionless.
Right. In the introduction, I did say that we're not just going to be focusing on the health implication and even the emotional implication. We're also going to talk about how it affects the environment. It doesn't just cause the death of organs like it's been raised. It also causes the death of the environment, as you see. In fact, like you said, World Health Organization has spoken about how this even affects agriculture in different countries where tobacco production and distribution is a major trend. We have a lot of farmers who would rather plant tobacco than actually plant crops, and it's so unfortunate that on a land where you plant tobacco, unfortunately, you can't really grow any crop on it because it causes soil depletion, right? And it causes that land to be prone to desertification. That's the issue. So you're not only distributing the product that would cause health problems, you're also rendering arable land somewhat useless for farmers who want to grow products. And even the theme for World No Tobacco Day for World Health Organization this year was grow food, not tobacco. That was the team. So let's talk about this. Aside from the problem of I'm just smoking, I'm not hurting anybody, you don't know that the farmer who grew the tobacco you're smoking at the moment have destroyed a certain amount of land that was supposed to be used to grow nutritious food. Talk to me about that, because I know that food and health, they're not very far apart. You have to eat to be healthy. So when people are not eating right because somebody decided to use the land that was meant for food to grow tobacco, how does that make you feel as a medical practitioner, first of all?
Okay, so you know, as a medical professional, we also want to advocate good nutrition, for people. And like you rightly said, that people, in fact, they prefer growing tobacco than growing food. Well, you can trace that back to the fact that
they make a lot of money off of it.
Exactly.
Right.
So that is just painful. It's painful that people think that way, right? And that's a very big problem in Nigeria, and even in Africa.
Even Africa, yeah.
Yes.
Globally too, is a problem globally.
Yes. Not even in Nigeria here that poverty is on the high.
We have food insecurity.
Exactly. So it's something we need to really, 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 really work on. And in fact, okay, let me come from this angle of okay, so a person smokes, right? Gets diseased, right? And then at the end of the day, it does not go to work, because that's the implication.
I mean, you can't go to work.
You can't go to work again, and then that's a reduction in human resource.
Right.
Yes, and that can also affect the economy too.
Right.
So if you're looking at it from that angle,
do you want to take my job? Please go on.
Yeah. So if you're looking at it from that angle, you see that if there are no human resources, there's even nobody to even work in the farm. At the end of the day. Right. So it's all this smoking thing is affecting. If you're looking at it from every angle, it's a problem. It's a problem, right?
Please, I see. I mean, you agreed with me from the very moment I opened my mouth about the state of the environment, about agriculture. I mean, there's the issue of global warming as well, because like you said, over 70,000 toxins associated with smoking, and that goes into the air. Like you said, it doesn't just disappear; it stays somewhere, and we're still, struggling with global warming. And even people think that it's just the heat wave, it's just the depletion of the ozone layer. Even what happens with land, even erosion and what have you, is also a factor to consider in global warming. So talk to me about that, the connection between smoking, the agriculture, like you said, the breakdown in human resources and what have you. Talk to me about that link.
It will be shocking to hear deforestation.
Right.
the major cause for deforestation is tobacco culture. Because when you cultivate tobacco, soil nutrients are disappearing. The soil loses its value fertility to grow anything. You cannot grow anything, name any crop, but the soil will become completely useless. So it has to be actually condemned seriously. This awareness has to be created that eat food, not tobacco.
Not tobacco. The World Health Organization has told us, please grow food, not tobacco. Because aside from what you're doing, you're destroying land for people who actually want to grow food. And any nation that is hungry, any nation that is malnourished, I don't see how they can grow as a nation. We're streaming live on Facebook and YouTube, by the way. Forgive me, I should have announced that earlier. So you can see everything going on in the studio. Facebook, YouTube, we're streaming live, Mainland 98.3 FM. If you want to see the faces to the voices that you're hearing, or you would like to contribute via those platforms, there's the chat option on there. Just leave your messages. I would definitely read the messages out loud. If you also have questions, you can contribute. I know that sometimes we get so carried away with the conversation, we forget to ask people to call in and ask questions. So you can ask questions if you like to call 0913 6000 410, or just send a text message 0913 6000 430. So because of our time, we have less than 10 minutes for this to be over. Let's talk about addiction, nicotine dependence, because that's one of the primary constituents of tobacco. That's what really makes people keep going back to that particular substance. So let's talk about addiction. Addiction is a problem. You lose your money, you lose your friends, you lose your family, you lose your entire life, because you cannot function properly even in an organization if you're an addict. Now addiction is not just with smoking. Addiction can be to anything. But since we're talking about smoking, let's talk about addiction. People who are addicted to smoking, who are addicted to tobacco because of the nicotine content. You are a doctor, I'm pretty sure, and you work with even psychotherapists, psychologists, and what have you, all work together. So after you've done your initial diagnosis, which we're going to talk about moving forward, what is the process of addiction like after you've gone through? Or let's just have everything together because of time. Talk us through the diagnostic process, first of all, where you say, okay, this person is not just a smoker, this person is an addict. And then talk us through the process of addiction. What is the next step? What do you do? How does this affect their lives? Do their families come around? Because I know doctors see a lot of things. You people have family secrets in your hands that you probably cannot share. So talk to us about that, Dr. Biyi. So we hear from Sister Gauthami.
All right. Okay. So symptoms of addiction, right? When a patient comes in, and then we take the initial assessment. And then sometimes they come in with just shortness of breath, some other symptoms.
Minor symptoms,
yes. So when we now probe further, then we now realize that, they do smoke, right? So there's this thing they call the 5 A's of smoking cessation, right? So the first is axe, right? So that's the that's the first one, axe. So axe is you want to know what exactly they smoke, when did they start, and for how long are they been smoking. Right, so the next is you want to now advise, right? So that's when you will now discuss about the health implication of smoking, and you want to urge them to quit, right? And the next is to assess. So you want to assess their willingness to stop smoking,
right?
Yeah. So the next is assist, right? So now you want to give them this is a point where we have a doctor-patient relationship where we would create a plan, right? A treatment plan for them, and then for them to follow, right? And then next is to arrange. So I want to arrange a follow-up for them to see them next 1 week, to just know how the progress is, So so there's some peculiar symptoms about addiction, right? So if you see someone smoking a lot and you can't do without it, you know that person's addicted, right? If the person who said he wants to stop, there's this something we call the withdrawal symptoms.
Right.
Symptoms like the person gets frustrated, the person gets angry, the person gets irritable, the person gets anxious.
Those are social implications.
Yes.
That's why they mostly lose their friends and families.
Right. Yeah. So when they don't even go for social events,
right,
with their
they're
family,
withdrawn.
they withdraw from them. Then this person is really on that, is really addicted to to it. So those things have highlighted the A's of smoking cessation is very, very key in when we are assessing and then giving
therapy, the cessation process, seek help when they get a lot, but they would not want to use the term I'm an addict, but that's just what they are. So talk to us about addiction and your experience with addicts.
First, and they would say that we have somebody and he needs serious help and he's not ready to accept and he doesn't want to professional help. He doesn't want to take any professional help. So that's where we are here, because you're a sister, you know them from long time. Would you like to talk to them? I said, why can't? And then yes, as the 5 A's, ask, advise, assess and assist and arrange. All of these things, I also follow the same process. And after all that, I really just quietly and with a lot of good wishes in the mind, what we can do is, we all, though none of us are smoking here, but we still can help the environment to be liberated from the smoking addiction. That is by creating a positive thought, having faith, giving hope, and telling them so that they can have a determined thought. Its determination is key to success. So when there is no determination, as in this 5A process, you will come to know, assess the person, his interest to be out of it and all. You can inspire the person, talk. But this whole family is also there, friends are also there, who are watching, observing what's going to happen. Is it yes, is it no? Is going to change or not? Accept or don't accept? But this all depends on the interactions that we have. And this has to be, yes, follow-up is necessary. You just call up and follow-up. The best way is nowadays WhatsApp. We send positive thought every morning. It's called as gift for the soul. And so it's only that to just rejuvenate the soul, hydrate the soul. The inner emotions and sentiments or vision is not hydrated. When they all get dehydrated, we tend to get into these type of things.
Just in a minute, if you can, because we're really pressed for time. How about natural remedies? So like, you just get to the doctor to talk to us about behavioral therapy, like diet, physical exercise.
Yes.
What role do all of these things play when you're going through the process of smoking cessation?
They all play a vital role. Yes, there are certain tablets, Ayurveda tablet. Ancient Indian medicine is called Ayurveda. There are certain leaves and certain tablets which can really create repelling feelings within you not to smoke, and you get that aversion thoughts. But above all, I say 70% is the mind game here. If the mind is completely aware of it, controlled, and you need to connection, here comes the part of meditation.
Right.
So meditation is to have an attention on the supreme source and connect in that silence, and then you charge yourself. So when the mind is completely charged, and when you have that supreme cosmic energy within you, and it's no juju anymore at all. It's just that you take his energy and you feel yourself, and that self-respect increases. When your self-respect increases, your mind is healthy. When the mind is healthy, it will heal the body. Healthy is all about heal thyself.
Right. Thank you so very much. If you can also, Doctor, please, I'm sorry I'm putting the time limit on your speech, but in 1 minute, if you can talk us through the treatment, behavioral therapy, what have you, and also family support, because I see that people, even in medicine, they heal faster when they have a support system. So talk to us about that in a minute, if you can, please. All
right. So basically, the treatment or the management for people that are addicted is a multidisciplinary approach, right? That involves the doctor, most especially the psychiatrist, and the psychotherapists, right? The behavioral therapists, even the religious leader. Yes, it could be an imam or a pastor, right? And also very importantly, the family, which is the bedrock of the person's life.
Right.
Yes. So just is a combined effort to making sure that. So in our own side as doctors, so if the patient is, of course, tobacco, nicotine addicted, so there's some things they call nicotine replacement therapy, right? They can be given like nicotine gums, sprays. So just the whole idea is just
gradually phase it out rather than just completely detach them, so they don't have the withdrawal symptoms. Right.
Yes.
Okay. Well, unfortunately, we cannot continue, but not to worry. You can follow us on social media at Mainland 98.3 FM. If you would even like to have personal conversations with, the wellness coach, Sister Olamide Gauthami, who's a representative of Brahma Kumaris. I tried so hard to keep that in my head. And also Dr. Biyi Durojaye. Just send us a message and we will connect you to this two persons. Thank you so much for coming. We appreciate you.
thank
This
you
was a
very
very
much.
wonderful conversation.
It's a great
Thank you for
pleasure.
making the job really easy
Thank
for
you.
me and the information. We really appreciate you. Well, that's where we'll draw the curtains for Health Plus today on Mainland 98.3 FM. My name is Sage Babalola. Up next is still on the matter, so don't go anywhere. The conversation certainly continues.